So gum disease, what we call periodontal disease, is a disease where bacteria get in the gums and can destroy the bone, leading to receding gums and eventually loose teeth. It's actually very important to treat, and it doesn't have symptoms, so a lot of patients don't know they have that. Oftentimes I see people avoid their cleanings for years or sometimes decades, and then their teeth get loose and need to be extracted. It's a silent disease and we don't want it to get to that point. So scaling and root planing, sometimes called a deep cleaning, is very important to remove the surface buildup that collect bacteria that cause this bone loss. A typical session for scaling and root planing can be either one visit or two visits, depending on a few factors. And we're going to make you very comfortable so that you do not feel the sensitive roots as we clean them. This can either be done with a topical numbing gel, or occasionally we anesthetize the area with injections. You should expect improvement in your gum health after scaling or root planing relatively quickly, within 1 to 2 weeks. There's a good blood supply in the mouth and it heals fast, and so your gums will reattach and shrink and become healthy within 1 to 2 weeks. Scaling and root planing can be done in one visit, but sometimes is done in 2 visits. This is for numerous factors. Sometimes it's insurance reasons. Sometimes they make us split that up. The other also can be patient comfort. If there's a deeper cleaning to this scaling and root planing, sometimes we just do half the mouth to keep you comfortable and do the other half the second visit. We recommend some aftercare steps after scaling and root planing to help your gums heal faster. One of those being a warm salt water rinse a few times a day. The other being some light brushing with a soft toothbrush to stimulate the gums, which will help the healing process go faster. After scaling and root planing, gum disease can return pretty quickly within months if you don't maintain that. The same bacteria that were there before can repopulate the gums. So we need you to come back more often for cleanings, not just every 6 months, but every 3 or 4 months, depending on the recall your hygienist recommends for you.